a lot of times we'll talk about the differences between human and veterinary medicine. And because a couple days ago, somebody had asked me, they were concerned their dog may have cancer. And I said, well, and they wanted to, we were going to do blood work initially. And I said, well, we don't have a specific blood test to check for cancer at this point. I always say we're 10 to 15 years behind the level of human medicine. But at this point, if an animal has cancer, our best chance is doing an x-ray or ultrasound or something of that sort.
We use a lot of the same medications.
Yes.
But the doses, that's the thing. The doses are so crazy different. Even, and it's just funny because you would think like a humongous horse would use 10 times the amount of the same medicine, but sometimes it's just the opposite.
Yep. The metabolism of dogs
Yeah.
and cats, like a hamster, are much faster, and they're going to break down the medicine much
Yeah.
quicker than a human or, again, a dog versus a horse. And I have had actually human doctors as as clients. The patient's the animal. And they just knew they were going to hurt their animal if they gave the dosages I had recommended. And I was always trying to figure a way, well, you stick to the humans and I'll stick to the animals, but I could never figure a diplomatic way of telling them. And one of my frustrations or pet peeves is that I'll give a dosage to have the pet owner give the pet, and later they'll tell me, like maybe at the end of the 10 days the medicine should be gone, and they still half of it. Well, they only gave half the dosage because they were afraid of hurting their pet. And it's just so frustrating because if you give half the dosage, you're probably not helping your pet. And some of these medicines are fairly expensive, and so it's always kind of a drive.
Also, in veterinary medicine, also uses a lot of human medicine that really isn't used much anymore. That's a little bit more outdated.
Yep, it's true.
But veterinary medicine is still using and is still current in veterinary medicine. So it's interesting.